Welcome, everyone. Hope everyone's having a wonderful afternoon. And welcome to the Jewish Public Affairs Committee of California panel discussion, Building Together a More Equitable Future. I'm Rabbi Noah Farkas. I work at a congregation called Valley Beth Shalom, but have been a longtime supporter of JPAC and of Jews involving themselves in civil society. I've spoken at JPAC a number of times, and it's just my pleasure to be here this afternoon to discuss how to build a more equitable future for California. The COVID-19 pandemic that we've all experienced for over a year has just exacerbated and spotlighted the major inequities in our society, from access to healthcare to broadband, food, housing, loss of jobs, and the systemic challenges that exist to make it harder for people to get the services they need. This panel of experts, which I'm about to introduce, will help guide us on their insights through the social safety net and what challenges and what opportunities can be pursued and what we can do as advocates in addressing these many inequities. Please welcome with me Abby Snee, who is the Deputy Secretary for the Future of Work at the California Labor and Workforce Development Agency. She, since COVID-19, has, and with the loss of over 5 million jobs in California, has focused her work on developing employment opportunities for those who are laid off. She's no stranger to JPAC, serving as CEO of the Jewish Vocational Service in San Francisco for over 35 years, growing that organization from $300,000 budget to over a $13 million budget. And she brought her leadership to the state of California, and now we're very glad to have you with us. Abby, thank you so much for being with us this afternoon. We're also joined, really glad to have you here. Also joined this afternoon by Anthony Wright, who serves as the Executive Director for Health Access, statewide healthcare consumer advocacy coalition, where he's been there since 2002. Health Access has led state and national efforts to win consumer protections, fight budget cuts, and invest in our safety net, and encourage prevention and advance coverage expansions and comprehensive health reform. Anthony, who is with us this afternoon, led California's coalition to help pass the Affordable Care Act and the state's laws to implement an improvement. Anthony, thank you so much for being here. We really very much appreciate it.
Great to be here.
And finally, but of course not least, we have Corey Rossella, who is here, who is the Deputy Director of the Western Center on Law and Poverty and an attorney on the Western Center's health team. Corey's health work encompasses security quality, affordable healthcare for low-income Californians through policy advocacy and litigation, and with a particular focus on Medi-Cal eligibility and due process rights. Corey leads Western Center's Diversity, Equity, and Inclusion Initiative, which includes centering racial justice in the organization's external and internal efforts. Geez, her work is so very valuable. Corey, thank you so much for being here this afternoon.
So great to be with you. Thanks for inviting me.
So let's get started and have a wonderful discussion. We're going to do 20 to 30 minutes of conversation as panelists and then open it up for the Q&A. Please feel free along the way to write your questions in the Q&A section of this webinar, and we'll try to get to as many as we possibly can. So California has always been a divided state, divided along all sorts of lines like rural versus urban, the coastlands versus the inland valleys, Northern California versus Southern California. But to some degree, we've always made it work in one way or another through interesting coalitions and power dynamics. But the global pandemic and the continued racial violence, particularly against people of color and the AAPI communities, have exacerbated these divides and maybe even added some new ones. In such a divided time, how has what you have learned and how has your perspective changed about how we can achieve equity in California? And Abby, I'd like you to begin if you're able to.
Sure. Thank you, Noah. And it's really wonderful to be here and to be back with, can't see your faces in the Zoom, but friends and colleagues from my many years at JVS. And I joined the state in January of 2020 and had about 2 months before COVID hit. and was brought on to support the Governor's Future of Work Commission, which, unlike most similar work across the country, was focused less on impacts of technology and automation and the robotic apocalypse coming for our jobs, and more on creating a new social compact and really looking at equity issues. And the pandemic and the related economic crisis revealed a depth of inequity in employment in California that we hadn't seen before. And, through the disparate impact of both COVID and job loss on low-wage workers and largely workers of color. Even before the pandemic, just under a third of California workers made less than $15 an hour, and the majority of those people are working full-time. And the majority of workers in California earning less than $15 an hour are women. And we know that women workers of color are 3 times more likely to live in poverty. So that was even before the pandemic. I think part of what we think of the pandemic just pulling the Band-Aid off of inequity and showing us how bad it really was and how worse it's gotten. We've also seen the frailty and the unevenness of the public safety net. Even with the federal government acting to expand unemployment, to supplement it, it's not available to all workers, especially undocumented, which is a huge issue here in California. And this economic crisis is a little different. And the workers who relied on UI benefits have been substantially more vulnerable. They tend to cluster in the food service and entertainment industries. They tend to be younger, lower educated, and people of color. And they've been really hit the hardest as public health orders shut down businesses and have been the slowest to respond and for those jobs to return. And they are frankly at the greatest risk now of facing long-term unemployment. So it is these essential frontline workers who faced both the economic challenges I've been describing and, of course, the health and safety risks, disparate impact of actual COVID and safety risks at work. And this is just having a really disproportionate hit on women and workers of color.
Thanks, Abby. Corey, maybe you can use your lens and try to address the same question.
Yeah, so again, thank you so much for the invitation to be with you today. Many of you have been great partners to Western Center in our work over the years. And just a little bit about Western Center. Founded in 1967, Western Center has been working on behalf of low-income Californians in the broad areas of access to housing, healthcare, public benefits, and what we broadly call economic dignity and access to justice. And we do that through the lens of both litigation, legislative advocacy, administrative advocacy, and then our work as a support center to help local legal aid programs lift up individual cases that we can then connect on a systemic advocacy level. So we're really focused on the safety net systems and really how people interact at various points in their lives in our broad areas. And we're always looking at that with a lens of racial justice. So the pandemic, as Abby said, really just laid bare all of the inequities that already exist. And for us, we haven't so much changed what we do in the last year, but really have kind of doubled down on what we do and why we do it. When you think about the various economic impacts of this, recovery from the last recession has been very uneven. When you disaggregate data of who is unemployed, who relies on public benefits, there's massive, massive racial disparities. And I can't say this more plainly, but this is structural. This is baked into the system. This is how the system was designed to work. If you think back of the original massive Social Security program, safety net program is Social Security. And who was left out of that? Farm workers and domestic workers, which were primarily the jobs that Black people held in the 30s. And now who holds those jobs? Primarily immigrants. And we see who is allowed to access services. And we're also thinking about you know, where California fits in the big picture of this. Nationally, the median white wealth is 7.8 times what the median Black wealth is in this country, and almost 5.5 times what Latinx wealth is. And in terms of income gap, California ranks 45th in income inequality. So while we are the richest state, we have among the biggest disparities for low-income Californians. So what we're thinking about is all of the different ways that our social safety net system perpetuates these kind of absurdities. We are looking at, Western Center right now is working on a strange aspect of the CalWORKS program. CalWORKS is what we would typically call welfare that's given to families, and right now it's requiring pregnant people on CalWORKS to continue working. So, why does this exist? We've done a lot of work around fines and fees and the criminalization of poverty. Some of our work around this has been the suspension of driver's licenses for failure to pay fees or tickets. And if you suspend someone's driver's license because they can't afford to pay their ticket, that means they can't also go to work to earn the money to pay the ticket. There's so many of these cognitive dissonances that keep people in poverty, that perpetuate racial inequity. And so we're really trying to uplift our work on that. And then internally, we're trying to make sure that the way that we work with each other inside of our organization and with community organizations also uplift those values of centering impacted voices, of being really explicit about racial impacts and the other disparate impacts at various identity points. So I'm going to stop there, although I could go on forever.
Thank you so much. We know that it's not just an economic challenge, the pandemic, a racial challenge, a social challenge, is also a healthcare challenge. So Anthony, if you could please also take a couple minutes, explain what you do and explain respond to the question.
Yeah. So my name is Anthony Wright. I'm the Executive Director of Health Access California. We're the statewide healthcare consumer advocacy coalition working on the goal of quality, affordable healthcare for all, and also the battles of the moment, whether it's fighting budget cuts or trying to expand coverage, working on the Affordable Care Act. We're proud to have great allies like the Western Center on Law and Poverty, and frankly, the governor's office in working toward those goals. And nothing underlines the inequities in our healthcare systems in a pandemic. Nothing. I mean, and I want to get to like the bottom line here, which is the severe, significant disparities in mortality, where we had loss of life across our state. But those early predictions that this is an equal opportunity virus. In fact, it wasn't. It actually had a dramatic, multiple times impact on Black communities, on Latino communities, on low income communities, and for some of the structural issues that both Abby and Corey talked about. And that's baked into our healthcare system as well, that our ability to respond to this, first of all, was based on, do people even have the ability to access healthcare? Do people have the ability to take off from work if they're sick and not potentially affect their coworkers? Do people actually have benefits at the job? About half of us here in California have coverage through work, but on the job benefits. But even among those, there was some issues in a world where we shut down significant portions of our economy. How many people lost not just their income and their job, but their health benefits as well? And does that make sense in for this or other health issues? For those people who happen to stay covered, there was issues about what would be covered. Was testing, was treatment covered? In what ways, and what financial barriers were there? And of course, for those who don't have employer-based coverage, who were either newly uninsured or who had been uninsured all along, what programs existed? We were glad that the Affordable Care Act was passed that created some sort of social safety net, but there was exclusions, and the most obvious and specific one is the one for those who are undocumented. We have a robust Medi-Cal program that covers about a third of our population, largely who are below or around the poverty level, but unfortunately that excludes um, uh, people based on where they were born, based on their immigration status. And so, we're proud that California has taken some steps to undo that exclusion, starting with kids and young adults. And we'll see if we can make some continued progress this year. But even if people get into the healthcare system, is this a healthcare system that is actually going to respond to actually treat them right and provide good quality care and at an efficient price, but also to deal with health disparities? And we know that, in fact, even if you hold for things like income and education and insurance status, there are marked disparities between in racial and ethnic categories on things like maternal mortality, or on just, again, what is your outcome coming out of a hospital. So what deal with those types of issues, whether it's some broader structural issues as well. So there's a range of things that we can do to hold the industry accountable to make this a system that is not just accessible to everybody, and not just affordable, but actually treats everybody with the dignity and with the outcomes that we want. The final thing I'll say is, I think that the thing that the sea change, that not just, I think I felt the urgency of the moment of this pandemic, but I do think that for everybody, we both not just got a sense of the importance of health and access to healthcare and coverage, but I think we got a sense of thinking about healthcare in a different way. I don't think there's been any time in the last 100 years where so many people thought about the capacity of our health system as a system, about how many ventilators we have, about how many ICU beds we have, about thinking about it as a system rather than as a commodity. And I think that once you think about that as then other things, then maybe the idea here is that maybe, in fact, like the old tropes that if more people are getting some, that means that maybe there's less for me, is no longer the operating term. Maybe the operating thing is, if we can make our system stronger our system is stronger when everybody is included. My health is tied to the health of my neighbor. My health is tied to that of the system that I need to be part of. And I hope that creates the sea change for policy changes going forward.
Anthony, I really appreciate that. And just if you don't mind, I'd like to follow up on that a little bit. And this is really for everyone, but maybe you'll take the first part of this question. So the pandemic has been a catastrophe for the world, and especially for low-income and people of color. And 100 years ago, the Great Depression was a catastrophe for many, many people. And out of the Great Depression, a raft of executive actions and legislation were passed within 100 days, effectively creating what became known as the New Deal. And while, in hindsight, many of those first level social safety net programs were more like, I don't know, like bulldozers or tractors as opposed to scalpels, and they were trying to solve massive problems without actually thinking about the people who are being affected by those problems. I see that the pandemic, and maybe you agree with me, could be an opportunity for us to reimagine what the social compact is and how the government can invest itself. And I don't want to get partisan or political, but I do think that there are civic responses to this pandemic that you're involved with, that everyone on the Zoom call is involved with. And I'd like to think with you, just turning to the future a little bit, about what you think some of the, how do we address the social challenges, the economic, the racist challenges, the health inequality challenges in California, not just thinking about how we got here, but how we use this pandemic and this unique opportunity in our state's history to write a new story.
Yeah, and I actually think that change is starting to happen. And I will say that I like the way that you phrased the question, because I was literally having a conversation with a state legislator Assemblymember Rambula, who is one of our champions of the Health for All campaign that we co-lead with the California Immigrant Policy Center. This campaign to extend coverage to all regardless of immigration status. And he was talking about, like, just as out of the Great Recession, out of the last pandemic, we got Social Security, out of this pandemic, we should get universal health care. That this is that's an appropriate response for everybody to now know that it matters to everybody if everybody has access to healthcare. That the more that we got this virus under control, the more that there were ICU beds available for me, whether I got COVID or anything else. But it didn't. But this wouldn't work if we're just thinking about this as just a purely commodity for me that's disentangled with everybody else. And I think that we see a little bit of that nationally with some of the investments that have been made, including some significant increases in affordability assistance in the new exchanges like Covered California, which I want to just, as a news you can use piece, if there is anybody who buys coverage as an individual, please take a look and see the new subsidies that are available for you. You could potentially save hundreds or even thousands of dollars. And because now there is, for the next 2 years, and hopefully will get extended, a government guarantee that nobody has to spend more than 8% of their income on coverage when buying it as an individual. And that's a huge thing. And we need to fight to make sure that that guarantee is not just for this moment, but going forward. And no place is that more important than California with our very high cost of living. I think that that's an example. I think there's other things that we can win at the federal level and at the state level, both with Covered California assistance and an expanding Medi-Cal, both for to not just get kids and young adults, but the rest of the population, with an emphasis starting with the older population that just got so slammed with this pandemic, but also in doing other things. And I know this is an issue that Western Center champions, removing the asset test that excludes people, seniors and people with disabilities, from getting the care that they need for just simply for the act of having some savings. And I'll let maybe Corey to continue on that.
Corey, go right ahead.
Yeah, so just to give a little bit of background on that, a person who is over 65 or has a disability cannot have Medi-Cal if they are what's called over the asset limit. And so that means if you're married, you're only allowed to have $3,000 in the bank. If you are married, you're only allowed to have one car. And that is a model for an old era. And, as Anthony said before, we need to start disabusing ourselves of these tropes that we have of who deserves healthcare, who deserves public benefits, who deserves help in our society. And the assets test really punishes people. Like, those are such low amounts. There's so little that you can do that it disincentivizes savings. And the message and the purpose behind it was really, you have to get rid of everything you have before the government will help you. And that means, you can just go without insurance if you happen to have two cars. And someone who lives in Los Angeles, that's just not possible for a family. And we know that we pay in other ways as well, right? We pay as citizens of this state for people who don't have insurance. It's not as though they don't have care. It's they delay care, their health outcomes are worse, and then we end up paying for them in our various uninsured programs. So Western Center, and I think this is on the list of issues that this group is championing, is trying to get rid of the assets test entirely, to say, just like the Affordable Care Act got rid of the assets test for people under the age of 65, to say, if you're low income, it doesn't matter that you have, you're saving for your children's college or you're saving for retirement. Healthcare is still an important thing. And to go back to what how we talk about this and how things can change. Even last night in the news, the president was defending the extra unemployment bump and saying, we're combating these very persistent myths that if you give people extra, they're going to be lazier. If we give them extra unemployment, they're just not going to look for work. And that is not true. And I think we are looking at some of these guaranteed income tests that say the way to help people in poverty is to help them not be poor anymore, giving them actual money and treating them with the dignity and respect to say that you understand the best way to use money for your family. Actually encourages people to get better paying jobs. It provides security when things happen, when you lose a job, when you have a huge medical expense. And that's going back to what I was saying earlier about the wealth differential. If you aren't able to amass wealth, you can't save for emergencies. You can't save for, pandemics or economic downturns. And then it keeps you in the cycle of poverty. Part of the New Deal was creation of the Federal Housing Authority. And they decided they weren't going to give loans to Black people. And so that was a massive way to curtail and absolutely cut off the accumulation of wealth in the Black population. And we're seeing that now, generations later. Part of what the New Deal did was to pay for infrastructure and to pay for freeways to be built right through cities. So, there's a massive freeway right in the middle, right through Compton in Los Angeles. And so I really like what's happening in the conversation of changing what is infrastructure. Isn't childcare infrastructure? Isn't allowing people to not spend their entire paychecks on daycare so that they can work a way to build up our workforce, build up our economy, make sure that our safety net is tight enough to hold those people up as well.
Thanks, Corey. Abby, do you want to add something to this part of the conversation?
Yeah, I would. Thank you. I mean, just to build on how we're thinking about infrastructure, and I know I'm really excited about the conversations that are coming out of the White House on a massive infrastructure bill. And as Corey was saying, defining infrastructure very broadly, beyond bridges and roads, which are in desperate need of repair, but also broadband. We hear about unemployed workers driving to their public libraries to sit in the parking lot to apply for jobs because they don't have access to decent broadband at home. I mean, and especially in California, anywhere in the 21st century, people should have access to broadband. Corey mentioned daycare. We have to think of the care infrastructure, both for children and for elderly. Part of creating a more stable infrastructure is making sure that those jobs, which are the fastest growing jobs in the economy, pay. And, one of the reasons that, there was such high COVID transmission in nursing homes is that workers earn so little there that they have to have multiple jobs at multiple facilities and went from facility to facility to, and then transmitted COVID. And something else we learned is that we have to invest in the public health infrastructure. Some of the work I've done in the last year is working with the public health system to make connections for unemployed Californians to become contact tracers, work in vaccinator roles. And I just learned how over the last generation that public health system was really, cut down. So we have to look at infrastructure very, very broadly.
Thanks. And I appreciate each of you also starting to work solutions into these challenges. I'm more, in some ways, more interested in the solutions than the challenges. That's what makes JPAC so important, is that in many ways, JPAC's the only state level organization of its kind in the Jewish community. It demonstrates again and again the need for investing in solutions, systemic solutions, and tries to draw the Jewish community into civic action. It's one of the reasons why I support it so much. I think it's about civics. So how can, because JPAC is a mobilizing organization, how can the thousands of JPAC members through the various organizations that support JPAC help you and leverage their JPAC's partnership in your work and working towards these solutions for health, for race, and for equity and economy? Who would like to take this question first? It's really open at this point. You want me to call on someone? I'm happy to call on someone. Okay.
I can kick us off. I think it's amazing that you're even thinking about this and asking questions. I think your contribution to this is and has been like very imperative. I think that uplifting voices and stories of people who've been impacted by this is one of the crucial ways to change hearts and minds. I think Anthony might, both Anthony and Abby might be able to speak to this even better, which is how much our legislators are, and I would say even judges in cases are really dying for stories of what the human impact is. And I think, whether it's calling in to support a bill or, finding people in your community who have been impacted and asking them to share their story makes such a difference. I think even a well-placed media piece can change really the discourse statewide. And I just want to kind of loop in a question that was in the Q&A about how to help with homelessness issues. I'm not doing the question justice, but basically, we as a state, and especially the city and county of Los Angeles, have devoted millions of dollars to, the homelessness crisis and getting people housed. And there was a fantastic story recently in the New York Times that says that a teeny fraction of that has been spent. One of the things that we do that is very important in Western Center is to hold these government agencies accountable, to call in and say, why is this not being spent? The resources that are there, the policy is correct. How do we connect this with real people? And I would also say that there are a number of community organizations who provide direct assistance. So in your work, making sure people are connected to the resources that are out there. I was working at a legal aid program and I work with a number of legal aid programs across the state that run an all-day hotline for health issues. And we know that only a fraction of people who are impacted get out there and are able to get the help that they need and that they could get for free.
Thanks, Corey. Abby, do you want to add to it?
Sure. And actually, I think what I'd like to do is step back and just share with you the recommendations that came out of the Future of Work Commission and spur your thinking about ways that you could help support these recommendations. As I mentioned, we really came up with a call for a new social compact that's built around 5 core recommendations. The first, and we had the good fortune of having Jennifer Granholm, who's now the Secretary of Energy, former governor of Michigan, who said, when I was governor, I would want a commission to come to me with moonshots, just really big, ambitious goals. And so that really set the standard for us. And so each of these recommendations has a moonshot goal and a set of more kind of intermediate initiatives. But the first being to ensure jobs for everyone who wants to work. And much of that work, we envision happening at the federal level, the idea of a federal jobs guarantee that has been brought up, and also within California, doing really careful, planning and partnership around the jobs that will be created in fulfillment of the state's and the governor's very ambitious climate goals. Second recommendation is to eliminate working poverty. We talked about this a few minutes ago, with, the sectors that we need so desperately, in care, in service, the people we've learned to rely on. People should not be working full time and live under the poverty level. We also need, and we've been talking about this throughout this whole panel, to create a viable, effective, comprehensive 21st century safety net. An immediate goal within that is to work on a benefits platform for domestic workers who work for multiple employers. There have been some models of that around the country. We also want to look at making California known for good quality jobs as much as it is known for sunshine and innovation. Really a first step there is creating a job, defining just what job quality is and defining a job quality index and using that as a economic metric to measure the economic health of the state. And then the fifth, and I love how lofty this is to future-proof California with jobs and skills, future-proof in terms of climate impact, wildfire, the impact of technology, and inevitable future pandemics, and to really future-proof both the workplace and workers with good jobs and good skills. And so, you know, we're rolling out a series of ways of implementing these, and would love to work closely with JPAC as those move forward. But that's a framework for the kinds of initiatives we'd love to see.